Okay, good morning everyone. Today we will discuss with you about effect of glutamine supplementation on metabolic variable in diabetes mellitus. My name is Gusman Santika and my friend is Annisa Mawaddah. We are from the Departemen Chemistry, University of Indonesia. This is the outline that we will discuss with you. The first we will discuss about diabetes mellitus, how diabetes affect the body, type of diabetes, risk factor for diabetes, and then overview of glutamine, synthesis and hydrolysis of glutamine, metabolism of glutamine, and then glucagon-like peptide 1, and glutamine supplementation, and in the last, the effect of glutamine supplementation in diabetes mellitus. Let's talk about diabetes mellitus. Diabetes mellitus refers to metabolic disease that caused by hyperglycemia as a result of impairment in insulin secretion, insulin action, or both. Chronic hyperglycemia increases inflammation and oxidative stress that have significant role in diabetes complication. As we can see in the pictures in this slide, there's some factors that will affect insulin secretions and actions, just like body weight, level of physical activity, smoking, heavy alcohol consumption, genetic predisposition, etc. And all these factors will cause a negative risk profile that will lead to hyperglycemia. In 2019, the International Diabetes Federation, or IDF, estimated that 1 of 11 adults has diabetes mellitus. How does diabetes affect the body? Diabetes mellitus not only reduces quality of life and life expectancy, but it is also will lead us to blindness, renal failure, myocardial infarction, stroke, and necessity to amputate limbs. There's a two type of diabetes. Type 1 diabetes, the people with this disease cannot produce insulin, and type 2 diabetes, the people with this disease will have less sensitive to hormone insulin. There's some factor that will cause diabetes for type 1. There's the exact cause is still unknown, but the factors such as family history, environmental factors, and presence of damaging immune system and geography will also increasing the risk to get type 1 diabetes. And for type 2 diabetes, the factor is age, weight, inactivity, family in history, race, gestational diabetes, polycystic ovary syndrome, high blood pressure, and then abnormal cholesterol and triglyceride level. Let's talk about glutamines. Glutamine is an amino acid or a building blocks for proteins that will found naturally in our body. This is essential. This is non-essential amino acids, and our body can produce glutamine about 50 grams per day. Glutamine is very important in our metabolism, and glutamine can be used as a substrate for a nucleotide. However, under some conditions, glutamine can be an essential amino acid. So we should take more glutamine from the outside of the body. For example, for the people with diabetes mellitus, have a glutamine amino acid below 50 grams in the body, so they need to take glutamine supplementation. Glutamine can be found in daily food such as beef, skim milk, white rice, corn, tofu, and egg. And glutamine can be synthesized and also can be hydrolyzed. In our body, glutamine is synthesized by the enzyme glutamine synthase (GS), and glutamine can be hydrolyzed by the enzyme glutaminase (GLS). And intercellular glutamine is catalyzed to lactate during glutaminolysis. Glutamin is converted to glutamate by glutaminase, GLS, and glutamate converted to alpha ketoglutarate by two pathway mediated by glutamate dehydrogenase. As you can see in the pictures in the slide, we can see that glutamine can be converted into glutamate, and glutamate can be converted into alpha ketoglutarate, and alpha ketoglutarate has their function in TCA cycle, and in this TCA cycle, it will produce GLP or glucagon-like peptide 1. Let's talk about glucagon-like peptide 1 or GLP-1. GLP-1 is a hormone produced by L cell in the digestive system from the transcription product of proglucagon gene. GLP-1 classified as insertin, and it has some functions such as glycemic regulation, pro-insulin gene expression, beta cell proliferative, stimulate glucagon insulin secretion, pro-insulin gene expressions, and inhibit glucagon release. GLP-1 secretion in L cell. Glutamin is converted to glutamate, then glutamate is converted to alpha ketoglutarate, and alpha ketoglutarate will increasing TCA cycle metabolism. And TCA cycle metabolism will cause GLP-1 secretions. The secretion process is regulated by active GDH or glutamate dehydrogenase. GLP-1 bind to receptor of pancreatic beta cell and produce an insertin effect. The insertin effect will stimulate insulin release and inhibit glucagon release. It will lowering our blood glucose. So glutamine supplementation is standard care when parenteral nutrition is given for critical illness. Glutamine is available in capsule, powder, liquid, and tablet. And how about effect of glutamine supplementation in diabetes mellitus? L-glutamine is important source of energies for cell in the intestines, and it will metabolize producing carbon dioxide, lactate, proline, citrulline, alanine, ornithine, and glucose. L-glutamine will increase and stimulate insulin release by helping a glucagon-like peptide 1. L-glutamine is an effective stimulus of glutamic cell, which can release GLP-1. And the conclusion is glutamine supplementation has a positive effect on glucose oxidation and insulin resistance. Glutamine supplementations enhance the circulations of glucagon-like peptide 1 or GLP-1. And GLP-1 can stimulate insulin gene expression, and it will play a role in controlling blood sugars level in patients with diabetes mellitus. This is the reference that we use to make this presentation. Thank you for your attention.